Doctors in private practice. Evaluation and management guideline and coding is one of the most common coding guidelines that you should or you normally would follow. But the question is, are you following the right guideline? So if you're watching my videos for the very first time, I represent Providence Health Consultants, a medical revenue cycle management company here in Houston, Texas, and we help doctors in private practice spend more time with their patients while we handle the billing and coding issues in the background. Today, I will be talking to you about evaluation and management guidelines. So, usually, E&M level depends on 3 points, right? The history, physical examination, and the medical decision making. History part of the medical records includes the HPI elements, so location, quality, severity, duration, timing, context, modifying factors, associated signs and symptoms, and review of systems, or otherwise known as ROS. So past family social history, PFSH. For the physical examination part is based on the patient's medical condition and the provider's report on the examination. So the number and complexity of problems that are addressed during the encounter. Now we're talking about the medical decision making. So the amount and or complexity of data to be reviewed and analyzed by you, the physician, and the risk of complications and or mobility or mortality of a patient management. The number and complexity of the problems that are addressed during the encounter, the certain numbers that are addressed, it ranges from low, moderate, or high. Low being one of the following, either two or more self-limited or minor problems, or one stable chronic illness, or one acute uncomplicated illness or injury. For moderate is one or more chronic illness with exacerbation, progression, or side effects of treatment, or two or more stable chronic illnesses, or one undiagnosed new problem with uncertain prognosis, or one acute illness with systemic symptoms, or one acute complicated injury. For high is one or more chronic illnesses with severe exacerbation, progression, or treatment side effects, or one acute or chronic illness or injuries that may pose a threat to life, to bodily function. Now, the amount and complexity data to be reviewed uh, and or complexity data to be reviewed and analyzed also is divided into different categories, right? I'll highlight the one for the low or moderate. So for the low, these are tests and documents, any combination of two from all the following that I'm going to present here. The review of prior external notes from each unique source, review of the results of each unique test, ordering of each unique test. Then for moderate, it is any combination of the following three or the following four: review of prior external notes from each unique source, review of the results of each unique test, ordering of each unique test, or assessment requiring an independent historian. So, um, I have prepared some slides on this topic and it is pretty extensive. If you like to see more of this, I can share it with you. All you have to do is send me a message, and I will send you this document that goes through all the evaluation and management procedures and how to code these E&M visits properly. Now, some of them are time-based documentation, and this need to be mentioned in your encounter. You have to specify the start and the end time of the session, total minutes spent with the patient, and like I said, I've prepared some slides that you can use and share it with your front office also. If you're interested in getting this, leave me a comment or send me a message and I'll email it to you. All right. That's all I had prepared for you for today. I hope you find this information useful and I'll see you tomorrow.